How does anticipation affect myotonic dystrophy severity? Imagine a family where each generation seems to face more challenges from a genetic condition. In myotonic dystrophy, especially type 1, this pattern is often seen due to a process called anticipation. Anticipation means that the disease tends to become more severe and start earlier in each new generation. This happens because of a change in the genetic material called the CTG trinucleotide repeat in the DMPK gene. When this repeat expands, it causes the disease to worsen. The larger the expansion, the earlier and more severe the symptoms tend to be. For example, smaller repeats, around 100 to 600, are linked to late onset forms that show up after age 40 and are milder. But very large repeats, over 750, can cause congenital myotonic dystrophy, which appears at birth with serious issues like developmental delays, breathing problems, and cognitive challenges. When a parent passes on the gene, the number of CTG repeats often increases, especially during egg formation in mothers. This means children can inherit a larger expansion, leading to more severe symptoms and earlier onset. This pattern is called genetic anticipation. It is more noticeable in myotonic dystrophy type 1 than in type 2, where symptoms tend to be milder and progress more slowly, and anticipation is less common. Interestingly, the severity and likelihood of passing on large repeats are influenced by whether the mother or father transmits the gene. Larger expansions and severe congenital cases are more frequently inherited from affected mothers because of how the genetic repeats behave during egg development. This means children of affected mothers are at higher risk of inheriting a more severe form, even if the mother has mild or no symptoms herself. The size of the CTG repeat not only influences how severe the disease is but also interacts with factors like age and sex to shape when symptoms appear and how they progress. Some genetic variations within the repeats can even delay onset or lessen severity, showing how complex the relationship is between the genetic mutation and clinical outcomes. For families affected by myotonic dystrophy, understanding anticipation is crucial for planning and management. It highlights the importance of genetic counseling to assess risks and explore options for family planning. In summary, anticipation in myotonic dystrophy type 1 causes the disease to become more severe and show up earlier in each new generation because of the expansion of CTG repeats in the DMPK gene. This effect is especially strong when the gene is inherited from the mother. Recognizing this pattern helps doctors and families better understand the disease's progression and guides decisions about testing and care. Always consult healthcare professionals for personalized advice, as individual experiences can vary widely.